Thank you everyone for joining us. Welcome to OLLI at the University of South Dakota in Sioux Falls, South Dakota. Normally USD is in Vermilion, but we do have some satellite locations, and not to be confused with balloon locations. We are here in South Dakota. I'm really glad you're here and joining us, and I know that some of you have come from a long ways away, so I really appreciate that you're here. Tell your friends we're going to be here every day, every weekday in February, except this Friday. We are going to be on location at a music concert at the old Courthouse Museum in Sioux Falls, so we won't be on Zoom on Friday. I would like to introduce my dear friend and OLLI aficionado and OLLI, she's just all for us. I love spending time with her. Chrissy Meyer, Chrissy from the American Heart Association. You're going to talk to us about Be the Beat. I'm excited.
Yes, I am. And so I've got, hopefully you can see my PowerPoint presentation now. We're going to talk about hands-only CPR today. And this is a topic that has, well, honestly, it's been in the spotlight for quite a few weeks now, especially all of us, I think, by this time kind of know what happened to the Buffalo Bills player, Damar Hamlin, when he was struck in the chest during a football game and had a sudden cardiac arrest. And the immediate reaction and immediate care of those on the sidelines that jumped in to help really kind of helped to illustrate why CPR is so important. So what we know is that minutes do play a role not only in survival, but in having full neurological function post cardiac arrest. So many of the people who do survive a sudden cardiac arrest or a heart event may not have that full neurological function, and that has a lot to do with CPR. What people don't understand, and if there's one thing you take away today, is that CPR is not about your heart, it is about your brain. We want to use CPR to preserve our brain. So let's talk a little bit more about what that means. So what is CPR? It is an emergency life-saving procedure performed when the heart stops beating. So what that means is that your heart stops and then we start performing CPR. So let's talk for just a quick minute about why your heart might stop. So a lot of times people confuse heart attack with cardiac arrest. I like to think about it in terms of in your house, you have plumbing and you have electrical. A heart attack has to do with your plumbing. So something gets clogged in your pipes, specifically some of the arteries that are leading to your heart muscle. So if you get a clog in one of those arteries, it can cause part of your heart muscle to die or to have damage. So that damage to your heart it can be permanent, it can be temporary, but the thing of it is that damage doesn't necessarily stop your heart. Now, a cardiac arrest is an electrical problem. That's when the impulses to the heart to keep it beating are interrupted and your heart stops beating. And so in a cardiac arrest, we want to begin performing CPR immediately. Now, it is possible that you can have a heart attack in which the damage to the heart is so severe that it causes that electrical problem. Think about it in terms of like if your house really, really floods, then you can have a problem in the plumbing system that affects the electrical. So that is the big thing. Heart attack, plumbing problem, cardiac arrest, electrical. In both situations, we want to call 911. And in case of a sudden cardiac arrest, that's when we want to start CPR. So our challenge is that we need to receive CPR in time. 90% of those who have a cardiac arrest will die. And a big reason why is that they don't receive CPR in time. The national bystander CP rate is less than 40%. So if you see something happen, it's important to act. The other thing that's important to note is that 70% of cardiac arrests happen inside the home. So the odds are, if you're ever called on to use this skill, it's going to be on a family member or someone you know and love. And minutes do count. You know, we talk a lot about time is muscle or time is brain, and that certainly comes to play in CPR. The bottom line, providing CPR can double or triple someone's chances of survival. So being able to jump in and react quickly is absolutely vital. Just a quick note, kind of talk a little bit, because we do get a lot of questions sometimes about, do you have to be certified to give CPR? And the answer is no, you don't. Now, if you are a healthcare provider, an EMT, a police officer, a first responder, yes, learning the full CPR and having that certification is a must. However, anyone can learn how to perform hands-only CPR, and anyone can teach others. So our hope is that today you're going to learn this, and then you can go out and teach other people as well. The other thing that's important to note is that most states, including the state of South Dakota, have Good Samaritan laws in place. And so you should never, ever feel afraid to jump in and help someone. You are protected by those laws. And it's also important to note that women receive CPR far less than men do. And a big reason why is accusations of inappropriate touching. If you are going to give CPR correctly and use an AED, which we'll talk about here in a minute, you do have to put it on bare skin. So you are going to either have to cut open their clothes to put that AED on. You're going to have to take the bra off. It's uncomfortable. It feels, but here's the thing, and I'm going to tell you this right now. If you see me have a cardiac arrest, feel free to strip me down and slap those AED pads on me. I'm totally fine, because I would much rather be alive and maybe slightly embarrassed than not here. So keep that in mind as well. So let's get into the nitty gritty. This is, excuse me, how to do hands-only CPR. Excuse me. So we're going to talk through this, and then I'm going to attempt to show you how to do it. We've got kind of a little demo set up over here. So first, I'm going to talk through the steps. Step number 1, tap the victim. Are you okay? Maybe they're just taking a nap. Maybe they're, maybe they just passed out and you can bring them to. But tap the victim, shout, are you okay? Point to someone, tell them to call 911, or you call 911 and put your phone on speakerphone. The 911 operator is going to talk you through the steps. So just in case you forget everything I just told you, they're prepared to walk you through. So you in the purple shirt, call 911. You in the red shirt, go get the AED. It's important to know where an AED is. I will also tell you that every single police officer, every police car, every fire truck, they all have AEDs on them. So if you're in home and this happens, start CPR, the AED will come to you. And then the next step, we're just going to push hard and fast in the center of the chest. So I'm going to stop sharing, and I'm going to pull this, and I'm going to turn off my camera so that you don't get sick while I'm wandering around here. And we will. Okay. So we have. Oh, move it back a little bit. Okay. Hopefully you can see me. So we have our victim here on the floor. So step 1, are you okay? Are you okay? Thea, call 911. Stacy, go get the AED. And now I'm going to start chest compressions. I'm going to take my hand, I'm right-handed, so I use my right hand. This hard part of my hand, I'm going to put it right in the center of the chest. Now on my dummy, he's got a little thing that shows where the sternum is. On people, this is not there, so you just have to guess. But you're going to put that hard part of your hand right in between, put the other hand on top. Now the key part here is we want to make sure our arms are straight. We're going to use all of the muscles, all of the weight in our back to do these compressions. And we're just going to push down. And we're just going to keep doing that. Okay. So if you get certified, you'll learn to do compressions and breaths. In hands-only CPR, we're just using our hands. So we're just going to continue doing compressions until either someone switches out for us or until some help arrives. Okay. Now, Stacy, she went and got the AED for me. Thank you very much, Stacy. And so I've got the AED here. I'm going to show you really quickly how to use this device. So we've got the pads, and you probably can't really see this very well, but on the pads, it shows exactly where you're going to put them. So one of them is going to go up here on the top of the chest, and the other one's going to go on the side. I can't really do that on my dummy because, well, he's only a halfie. So we're going to go here and over here. Once the pads are on your AED, there's a button to turn it on.
Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Charging. Stay clear of patient. Deliver shock now.
So
Press the orange button. Shock delivered. It is safe to touch the patient. Begin CPR.
Okay, so then once the shock is delivered, I can go back to doing my compressions. I don't know if you could hear the AED super well, but it literally walks you through exactly what to do and how to do it. So don't be afraid to use the AED as well. So that's our quick little demonstration. I'm gonna, once again, turn off my camera and get back up into my chair. So hold on. Okay, so what questions does everyone have?
Are we supposed to be singing Staying Alive for the beat?
Well, yes. The truth is, I was trying to get my phone hooked up so that I could actually play the music, but technology was not my friend today. But yes, for those of you who remember the song Staying Alive, you can think that in your head. Grandparents, another good song to think about is Baby Shark. That is another one. There's also, yeah, that'll be in your head all day. There are a bunch of songs that are about that 100 to 125 beats a minute, but Staying Alive is the one that we frequently think about.
Go ahead, Annette. Antoinette.
Okay. How can you tell if somebody is having a heart attack or if they just went into cardiac arrest?
You know, you really can't, unfortunately. The lay person, the average person, you can't tell. So in what I would say is if they are non-responsive and they are not breathing, start compressions right away. And again, the reason why we want to do that is because we want to keep oxygenated blood flowing to the brain. Remember, CPR is not about restarting the heart. That's what the AED is for. So yes, we want to use the AED to do that. But CPR is about keeping blood flowing to the brain so that we don't lose neurological function. So if you don't know, just start CPR.
Linda Weber has a question. You're on mute, Linda.
Okay, sorry. You commented about with women and having to take the bra off and stuff. Can you just push it up? Would that be okay?
You could. You could. The only caveat that I would maybe say is that if it is an underwire bra, we want to be careful with electricity.
Mhm.
Because that is a conductor. So it's usually preferred to either just cut through, and a lot of times AED cases will have a pair of scissors in there for that exact purpose, to cut open clothing, cut through, or take it off, just because we want to be careful about that.
Thank you.
Go ahead.
If you're in a place that doesn't have an AED, you're going to start CPR, but chances are slim, aren't they?
Not necessarily. And the reason why, so yes, it does depend on where you are. So in Sioux Falls, for example, the average response time is 6 minutes for first responders to get to you. Oftentimes it's less time. So they'll get there with the AED and then, can administer that. Now, if you are in Buffalo, South Dakota, the amount of time it takes for EMS to get to you is longer. So yes, that can be a challenge. However, that's why most, if not all, law enforcement in the state now have AEDs in their vehicles, because we know that oftentimes in those areas, it's the county sheriff that will get to you first before an ambulance or, voluntary fire or something like that. So it's not hopeless. It's absolutely not hopeless. But doing CPR is the one thing that you can do to keep that, again, oxygenated blood going until they can get the heart restarted.
So if you're in a place where there's no AED and you have to wait for somebody to bring it, when you're doing CPR, if they're not breathing, should you do the breaths as well?
Ideally, doing the breaths does help. Yes. If you have been trained and have the full certification, know how to do the breaths, absolutely do it. If you're uncomfortable, then just doing hands-only CPR is adequate.
Okay.
But if you have the full training, are comfortable doing the breaths, absolutely do it.
Okay, thank you.
Chrissy, I'm always afraid that I would break somebody's ribs if I put my hand in the
Oh,
wrong
you will.
place. Does that happen?
All the time. Yes, you will. And frankly, if you're doing CPR correctly, you're going to either break some ribs, crack some ribs, maybe separate from the sternum just a little bit. It is going to happen. But one of my very favorite of all time survivors, she's a CPR survivor, and she's very clear about it. And she says, here's the thing. That person that's laying there on the floor is dead. They're not going to feel their ribs break. They're not going to feel any of that. They are dead. And unless you do something, they will never be alive again. And she always says, I was completely happy to wake up in the hospital with a couple cracked ribs and wake up.
Good. We have a question from Raymond. Go ahead.
Actually, I didn't know how to change the name. It's his wife, Leslie. But question,
Hello.
I'm afraid of the opposite. I'm afraid I won't push hard enough. Do you use like full force, as hard as you can?
Yeah, that's a great question. So yes, that is definitely a concern, not pushing hard enough. And that's where, unfortunately, this Zoom environment is not ideal, because you can't actually get your hands on the dummy to practice. So what I will offer is, and this is up to Thea and Stacy, is that if any folks that are in Sioux Falls would like to have like an office hours demonstration sometime and have me bring a dummy in, and you guys can come in and just get your hands on one sometime and practice, I'm happy to do that, because you do have to push hard, and you do have to, it does take a lot of strength. And you probably saw me, I did like 10, 15 compressions and I was out of breath. It's exhausting. So it is something that once you do need to practice and get your hands on one to actually feel what it feels like.
Are there any other questions for Chrissy? Chrissy, as South Dakotans, and I know that there's a lot of people here who aren't from South Dakota, but I'm sure it's similar in other places too. We have that Midwest nice thing where if I'm not feeling good, I might say, oh, don't call an ambulance. They're busy. They're for somebody else. Let the people who need them use it. Does that happen? Do you hear of that?
We do hear that a lot, and it is definitely something that we run into a lot in the Midwest. We also run into a lot of people who say that I'm not going to call 911. I don't need the ambulance. I'll just drive myself to the hospital. You know, the thing to say about that is that there is not a doctor or an EMT or a paramedic or a voluntary fireman in your community who is ever going to look at you and say, man, you were really an idiot for calling 911 for that. Even if it turns out to be just a really bad case of heartburn, get it checked out. And the number one thing is, you know your body better than anyone. If something doesn't feel right, get it checked out. If something comes on really fast, but then goes away, and it's like, it went away, I'm fine. It'll come back, get it checked out. No matter what, just get it checked out. And for God's sake, please do not drive yourself to the hospital. If you're having a heart attack, the safest place for you and everyone else around you is in an ambulance. And the thing that people don't understand is that your treatment starts the minute that the volunteer firemen, the EMS, EMTs, the minute that they arrive, your treatment starts. Every single ambulance in the state of South Dakota is equipped with a 12-lead EKG. So in your living room, they can identify what's going on, and they can activate if they need to call a chopper to meet them on the edge of town. Or like, I met a woman in Canton, the helicopter landed in her hayfield and flew her to Sioux Falls. So if that, we can activate that system right from your living room if we need to. So don't be afraid. I'm seeing Ben's comment or question in the chat. How long do you do compressions? You do compressions until someone relieves you or until help arrives. So it can be a long time, but hopefully not very long.
Good question, Ben. Any other questions?
And I also saw the question about a copy of the slides. Yes,
yeah.
I will send that to Thea so that you have those as well.
Okay, thank you.
Yeah, so if
Hey,
you do want a copy of the slides, send us an email. Our email is OLLI, OLLI @usd.edu. Send us an email and we'll know to send you those slides. Thank you. Stacy just put it in the chat. And it looked like Anne had a question.
You mean?
Yes, great question, Anne. So women are more, the way I describe it, women are more subtle. So with men, oftentimes the number one symptom that they describe is that crushing chest pain. It feels like an elephant sitting on the chest, or maybe the pain radiating down the left arm. But most frequently with men, it is that pain that is their number one symptom. In women, it's slightly different. Yes, women will feel that chest pain, but they also experience a number of other symptoms, including, maybe neck or jaw pain, pain in the upper shoulder area of the back, heartburn, nausea, sweating, shortness of breath. So again, if you are experiencing anything that seems out of sorts, just get it checked out. The other thing I'll put a plug in for anybody, all three of the major health systems in South Dakota, Sanford, Avera, and Monument Health, all three of them offer heart screenings. And you can go in and get a heart and vascular screening. On their own, they each cost $50, but if you do them as a bundle, you get a package price of like $75. But you can go in and do that screening, and it will identify some of the, if you'll get a calcium score. It'll identify if you've got any issues with calcium buildup in your arteries. It can help identify those problems before they become out of control. And so that's one of those screening tests that we recommend that anyone over the age of 40 go in and have that done. It is, like Thea says, it's easy, it's fast, it is completely painless. And frankly, the peace of mind that you get from it is really great. Another thing I will put in that chat here. This is My Life Check. It is an online health risk assessment that the American Heart Association offers, and it goes through what we call Life's Essential 8. And so you can go online and go through this quiz to look at some of your risk factors and see if there's something that maybe you should address with your doctor.
Go ahead, Linda.
Now with the AED, it can sometimes, or it's expected to start the heart. Can the compressions alone, do they ever start the heart?
That's very, very, very rare.
Wow. All right. Well, I think we have all learned a lot today. I never knew there was a difference between a heart attack and cardiac arrest. Never occurred to me. So I think that's my takeaway from today. Thank you. Anyone have any last minute questions? We've got about 1 minute left. Anne has a thumbs up. All right. All right. Well, thank you everyone for joining us today, and especially thank you to Chrissy Meyer from the American Heart Association. She does a great job. Yeah, look at all the hearts popping up. There we go. We love having you here, and next year we're going to do food again, okay?
Perfect.
Okay.
And I just threw my email in the chat. So if there's anything anybody has any questions on, please feel free to reach out. I'm happy to chat more.
Excellent. I'll leave that up for just a minute. Chrissy Meyer, chrissy.meyer@heart.org. That's a pretty easy one to remember. Thank you, Chrissy. Everyone, have a great day. We'll see you
Thank
tomorrow,
you.
and we're going to find out about Wahoo, Nebraska. Don't forget. All right.
Thank
Take
you.
care.
Thanks so much.
Thank you.
Bye.
Thanks, everyone.